people of the Salinas Valley, the taxpayers of California, and the state legislature deserve to know if the hospital has been acting ethically and appropriately.
In May of 2011, the Joint Legislative Audit Committee granted the request by Assemblymember Luis Alejo to have the state auditor take a closer look at the inner workings of the Salinas Valley Memorial Healthcare System and the actions of its CEO and board. 11 months later, in March 2012, a 78-page report by the Bureau of State Audits found that increased transparency and stronger controls are needed to improve the financial operation of Salinas Valley Memorial. Assemblymember Alejo talks about what motivated him to ask for the audit.
The Salinas Valley Memorial Hospital came under national scrutiny when it was revealed that the outgoing president and CEO was leaving with a near $5 million supplemental pension and severance package upon his departure. And that set a record here in California for the highest pension and severance package for any public hospital here in our state. Response from the hospital about these lucrative executive benefits were, quote unquote, these were well deserved. Downing himself told all local news outlets that I've earned it. I think I've earned it, was his quote. The hospital has responded to the layoffs by saying that they are overstaffed for the number of patients utilizing the hospital, and perhaps they are. But the purpose of this audit is to make sure that our tax dollars are being spent appropriately. It is not my purpose to embarrass anyone, but this audit is crafted to shed light on the situation at the hospital and to guarantee that the public dollars are being spent to serve the needs of the community in the best way possible. The auditor will investigate whether any inappropriate relationships or activities exist between board members and organizations they are related to, and determine if these relationships have any impact on the hospital's operation and services. This audit is intended to shed sunshine into the operation of a public hospital that has been functioning without public scrutiny for too long. The results will let us know if the financial management of the hospital is negatively impacting the services the hospital is able to provide, and will provide us also with recommendation to fix the problems in other public hospitals throughout our state. The people of the Salinas Valley, the taxpayers of California, and the state legislature deserve to know if the hospital has been acting ethically and appropriately.
From an accountability standpoint, it's appropriate to review the evolving nature of these units of government and measure them against the original function and purpose. It's also appropriate to question whether these districts need to continue to exist as government entities and whether another local entity could more efficiently fulfill the public purpose that they now serve. During these economic times especially, the legislature should reasonably question the use of scarce local resources for purposes other than basic health services for those who are sick and or uninsured. We too rarely look at doing a better job of meeting our most pressing needs with the resources that we have available. As we explore these specific districts, we should not only question if they are serving a valuable public purpose, but question if it is the highest priority public service and if it is appropriate